The National Institutes of Health report nearly 35 million surgical and non-surgical aesthetic procedures in 2023. While Botox and filler accounts for a lot of that naturally, the trend shows a steady increase in facelifts in recent years as their popularity has significantly increased in recent years, especially among younger individuals. While this isn't her first, I feel like we can't talk about facelifts right now and not talking about Kardashian matriarch Kris Jenner's recent facelift because it went viral. Here's a picture. Her on the left, her on the right. She's 69. She shared with Vogue Arabia that she was on the cover of last month, that she had a facelift about 15 years ago. She felt now was the right time for a refresh, and man, did they do the dang thing or what?
She looks like her daughter. We have New York and Denver plastic surgeon, Dr. Samir Hasan. Am I saying that accurately? No? Is yes? Okay, good. I just want to make sure I nail it. But also, people know you as Dr. Beauty Blade, which is so cool. You're here to talk about all the latest trends in Colorado facial plastic surgery. So speaking of facelifts, and even right when you sat down, I already had my questions for you about like that lower.
She's got questions.
Yeah, because it's improved so much. I mean, I look at, let's go back to Kris Jenner. I look at her very first facelift compared to the one now. What are some of the innovations that have led to that?
Yeah, you know, I think traditional facelifts back in the 80s, 90s, a lot of the emphasis was on skin removal only. But the deep plane facelift, the deep plane neck lift involves moving and restructuring the deeper tissues of the face, which gives folks a more natural look and more longevity with their lifts. I think a lot of folks will opt for the deep plane in their 50s, 60s, but some we've seen even as early as their 40s coming in to really lift the cheek back to a youthful position up high on the bones with this deep plane facelift. And with heat and energy, that's probably the biggest change I've seen in our practice. We're able to remove less skin and get lifts and contouring with heat energy under the skin during surgery through tiny incisions. So facelifts are becoming something that are kind of hybrid, involving a little bit of skin removal and also skin tightening with heat depending on the patient.
For Kris, like that.
Yeah, Kris Jenner, I think that's incredible. She looks just like Kim.
Yeah.
And that's a really well done facelift. It's natural but youthful.
How much does something like that cost?
Yes, that's what I'm wondering.
Keep it real here.
It's such a wide range, depending on the city.
Give us the range.
I think you can see them for as low as $20,000 to as high as $250,000, depending on who's doing the surgery.
I've heard hers was about $250,000.
$250,000?
Look at her, it's worth it.
Mortgage. Oh my God.
That's incredible.
Yeah. Right.
Wow. And before you ask your next question, I'm just curious, what is this heat that you're using? Is it like laser?
So it's radio frequency energy that I had it in the car, I forgot it, I'm sorry. But you can pass it under the skin and heat up the skin from below and above. And over time, it'll cause tissue contraction, build collagen, help to fill in fine lines, and tighten the skin without cutting it.
Oh, yeah, minimally invasive.
Yes.
I'm like, I've got a thing going there.
Oh, please.
You see that?
If anybody does that.
Well, here's the thing. What has happened since 2020, right? Post-pandemic, we've had more people on their phones doing Zoom meetings, virtual meetings. We're all looking at ourselves, seeing this. So I think that's kind of why we've had a boost in folks getting facelifts in their 30s, 40s.
Talk to me about eyelid surgery, because this is something you say you can do awake for some folks.
Absolutely. The eyelid lift, that's one of my favorite facial surgeries. This is what you see, right? When we were doing masks, everybody was just seeing this.
True.
So eyelid lifts involve a removal of skin, sometimes muscle, and a little bit of fat to open up the eye a bit more. For the lower lids, you can also do that awake and take out the bags, or you can restore hollow areas. We lose fat, we lose bone as early as our 30s. And so anytime I see someone for an eyelid lift consult, I'm looking at, do they have hooding? Do they look tired? And do they have bags under the eyes? Those are things that prompt people to come in as early as their 20s, 30s.
Yeah, I get it.
Let's talk about bags, because that's an issue. What about like PRP? Are those things you're doing at your...
Absolutely. So let's talk about injectables too. PRP.
Tell the viewer what PRP is, because I've had it done and I loved it.
So PRP, you draw the blood, spin it down to just the growth factors. It can be injected in the face, the under eyes, or along scars to lighten. But for people with bags, we are seeing a lot of folks come in early 20s, 30s who are on Ozempic, or they've just had a lot of stress and they've got this hollowness. PRP, fat, and biostimulators that build collagen are all great options to restore the eyes, non-surgically. And sometimes we do it with surgery.
Wow. I wish you were here for like the whole hour, but really quickly, like jawline contouring. I use, not highlighter, but.
Contour?
Yeah, but what is it? I guess contour, and I go under here, I go here, but there's the surgery version of that.
I feel like we're seeing a lot of these things coming out where people are doing stuff every day, but surgery gives you that result and it stays with you. So the gua sha, the lymphatic massage, the facial massage, it'll look good for that day, for that evening event. But if you were to do a jawline sculpting with liposuction and the heat, I think you're gonna love the results.
How much does something like that run? You asking for a friend?
Yeah, so the jawline sculpting can run anywhere from $6,000 to $15,000, depending how much is done.
But it's permanent.
It is permanent. And so you avoid having to get injections, you avoid having to get fillers. I always counsel patients and tell them, look guys, if you want filler on the jawline, it's gonna widen you. Instead, it's better to contour this, remove fat, and stay natural.
Such good information.
I know.
Dr. Hasan, thank you so much.
You guys are so welcome. Thank you for having me.
Of course.